in my community, complex chronic disease, a lot of people are pretty limited on how much activity they can do as because of something called post-exertional malaise. So they do some activity and then they really crash and pay for it. So just with that in mind, so I always warn my guests, don't recommend training for a marathon because everyone's going to turn you off. But say people feel that they might be able to do a little bit more activity, how would you recommend they go about it?
Yeah, Ellie, you're exactly right. I've taken care of hundreds of patients with chronic fatigue, and
Okay.
I love them. They're amazing patients, and many of them are super driven. They're like, tell me what I need to do, and I'll do it 5 times better. Or
Yeah.
which
Yeah.
I love that attitude. But exercise is not one of those things because they'll overdo it. Exactly right. If I say, you know walk for 5 minutes, they'll run for an hour, and then I'll spend the next couple of weeks try to clean them up
Yeah.
because so again, what I would say is yes to a little bit of exercise, but go low and go slow. For normal people, it's an amazing thing, but you have to titrate it. You have to go low and slow because what can happen, unfortunately, many of these patients will have biofilm. And when you exercise, but biofilm is this biologic film that
Hmm.
has infections, mold, and other toxins, and the biofilm can be in your brain, in your bloodstream, other tissues in the body. So the challenge is that when you exercise, you're very quickly pumping blood through your heart valves, and the biofilm in the blood can get released. And then within the biofilm can be these heavy metals and other infections,
Okay.
and people can get worse. So
Got
so it's
it.
a double-edged sword. I would say definitely titrate it, and you definitely also want to be on glutathione, the master detoxifier, to be able to deal with the side effects of of the exercise,
Releasing. Yeah.
releasing all these toxins.
Wow.